Hi, I'm Colin Hung with Healthcare IT Today, and I'm here with Kyna, CEO of Elation. Kyna, welcome to the program.
Thank you, Colin. Appreciate it.
I'm excited to talk to you because you focus on the direct primary care market, which isn't sort of like the traditional primary care market.
Yeah.
Tell us a little bit about the difference and tell us why you've been so successful in that space.
Yeah, absolutely. So the direct primary care market is really thinking about how you enable primary care physicians to go back to practicing medicine the way they wanted to when they started, going to medical school. And so the many people attribute the fee-for-service third-party insurance reimbursement system as a big source of why primary care's lives are so hard and unable to help their patients the way they want to. And so direct primary care is one would say, a reaction to that reality. And so they involve direct payment. It's primary care that's provided in return for direct payments, either from patients themselves who are paying a monthly membership fee or from employers who pay for that service for their employees. And all of it is part of a movement to say, hey, can we get more out of our primary care dollar? And can we not only enable better outcomes and lower costs for our patients, but make physicians' lives easier as well? And so, Elation was built from a clinical first philosophy, from a very mission-driven perspective of how do we enable high-quality primary care and personalized medicine for every patient. And so direct primary care is a very natural fit with where we're focused and what kind of impact we want to have in healthcare.
And what are some of the interesting developments that you're seeing in the direct primary care market? In other words, what are you really excited about when you look at that?
Oh yeah, absolutely. So the things I'm excited about really relate to first of all, just the growth in that space, the success of the early DPC players who are continuing to grow. And I would say the uptake by employers of this model, because that's going to enable this model to scale. If you have, you can only necessarily get so far with patients paying out of their own pockets.
Right.
Once you tap into the employer market and they're seeing the return on their investment on paying for these direct primary care models, you're going to see kind of increasing growth and therefore innovation, uptake. And ultimately what I'm super excited about is to see the convergence of these type of direct primary care models with what is a more mainstream, quote unquote, value-based care that is happening within payer models, but certainly an innovative part of that space that is trying to counter the exact same problem, which is our financial incentives in our current healthcare system are messed up, and we need to rethink those from the ground up. So that's definitely what I'm most excited about.
Tell us a little bit more about what Elation does. What is it that your product and your platform enables DPC providers to do?
Yeah, absolutely. So at Elation, we are a purpose-built platform for primary care. And so, what Elation enables is, at the end of the day, the physicians to be able to focus on care for their patient. And that actually, and frustratingly for many, is a very, very big task. So It's not only delightful tools at the point of care and user experiences that support actual patient-physician interactions, but it's also, how do we get rid of the overhead in healthcare? How do we get physicians to get paid for the work that they're doing? How do they get credit for the quality that they're performing? And even beyond that, as you think about a more digitally enabled world where there's technology platforms out there and increasing amounts of data available, a big thing that Elation does is it brings in that data and makes sense of it for our doctors so they can take action to make good decisions for their patients, and connect with other technologies in our ecosystem that, again, can create a more continuous, coordinated experience for patients.
Where can people go to find out more information about Elation?
Yeah, you can visit us at elationhealth.com and learn more from our website.
Awesome. Kyna, thank you so much for being on the program today.
Yeah, thank you, Colin. Really appreciate the time. Thanks for having me.
This has been Colin Hung with Healthcare IT Today. Thanks for watching.